Thank you for joining us today. As we continue to respond to the COVID-19 pandemic, the University of Maryland Medical System will be hosting these webinars on a more regular basis to ensure that our communities are fully up to date on what we are doing to combat COVID-19, as well as steps you can take to protect yourselves and stop the spread. Dr. Mohan Santa, the President and CEO of UMS, and Dr. David Marcosi, our system's COVID-19 Incident Commander, will be presenting today on a number of topics. We will spend most of our time discussing the much anticipated COVID-19 vaccines, and we will have the chance to talk with two of our frontline healthcare employees who received the vaccine just this week. I will now turn it over to Dr. Santa to get us started.
Thanks, Chris, and good afternoon, everyone, and thank you for joining us today. First, we want you to know that you can turn to the medical system as a trusted resource for information on COVID-19. And please, if you ever have questions, please reach out to us. The medical system has established a free call line staffed by nurses that you can call anytime, day or night, to discuss concerns or possible symptoms. You can reach the nurse call line at 1-888-713-0711. We should also note that the Center for Disease Control has also a COVID-19 tool on their website that you can use to evaluate symptoms that you might be experiencing. And finally, you can find tips on managing your health and wellness at umms.org/COVID. Now, before we jump in and talk about COVID-19 vaccines, I'd like to give you a quick snapshot of the situation across the nation and here at home in Maryland. Since this pandemic began in the United States, we have lost more than 310,000 Americans to this disease. Here in Maryland, we have tragically lost 5,188 people to COVID-19 since the spring. And as you know, cases continue to rise. In the United States, we have now exceeded 17 million people diagnosed with COVID-19. In the state of Maryland, we now have over 245,000 Marylanders diagnosed with COVID-19, and across the state, the COVID-19 positivity rate is 7.77%. Lost at times is the fact that these numbers that we follow so closely represent loved ones, grandmothers and grandfathers, mothers and brothers and sisters and fathers and friends and neighbors, co-workers and children who won't be with us during this holiday season. Some of the challenge associated with this pandemic is to try and fathom the scale and magnitude of loss associated with this disease. And that is a challenge that we face within our organization on a daily basis, whether we are at work or whether we as medical system team members are at home with our families and friends. So many of us have been touched by this virus. And please know that our collective thoughts and prayers are with each and every one of you. Today, though, we believe that there is reason for hope and optimism. As I'm sure you have heard, we are now providing the very first COVID-19 vaccines to our frontline healthcare workers. Last weekend, both the FDA and the CDC authorized the use of vaccines in the United States, and the medical system received its first shipment on Monday. What's more, we could have a second vaccine approved for use at this time next week. This is incredibly exciting, and we're going to talk more about what all of this means and how we got here so quickly in a bit. But first, I thought it would be helpful to take a step back and discuss vaccines in general. Some of you may have questions about vaccines and whether they are safe, and especially whether the COVID-19 vaccines that have been in the news are safe. It's important for us to seek out answers to our questions and concerns, and to be educated so that all of us can make informed decisions about our health care. So this may mean reading published scientific information, listening to COVID science experts, speaking with your doctors, and most notably, speaking with trusted voices. And so part of this conversation that we are trying to have as a medical system is to provide information to you in the community because you are ultimately trusted voices. But please notice that of the mentions that I made about trusted voices, I did not mention social media. As much as I value social media and how it has allowed us to stay connected during this challenging time, the truth is public health experts are very concerned about the amount of misinformation that is online and how difficult it is sometimes to tell what is true about the vaccine and what is false. So today I'd like to provide just some facts about the vaccine in general and about COVID-19 specifically. My hope is that you'll come away from this webinar with fewer questions and more comfort about the COVID-19 vaccine and whether it's safe for you or your family to receive it when it is your turn. So let's start with what vaccines are and how they work. A vaccine helps train our body's immune systems to recognize a specific infection so that that infection can be defeated quickly. When you receive a vaccine, your immune system spots a potential infection and tells your cells to prepare to fight. So our cells then produce something called antibodies, which will stand on the lookout for any signs in the future of a germ or infection and be ready to attack it as soon as that infection or germ shows up. So why are vaccinations so important? So some of the most harmful diseases throughout the history of mankind are much less common because of vaccinations. Let's just discuss two examples of illness that I'm sure you've heard of, but likely have been lucky enough to not encounter in your own personal life. Polio caused paralysis in children all over the world until a vaccine was introduced. Today, there are no cases in the United States and only rare cases in a small number of countries. And in those countries, it is most likely because vaccination access has been limited. Similarly, smallpox led to widespread illness and death for centuries until a vaccine and a worldwide effort to vaccinate led to its complete elimination. There has not been a single reported case of smallpox since 1977. Other diseases that were once very common, such as measles, meningitis, whooping cough, are now very rare because of vaccinations. Vaccines have saved the lives of many people around the world, and in fact, I'll share you some key facts with you that I think very clearly show the impact of vaccines on humanity. Over the course of human history, human life expectancy has gone from 40 years of age to 82 years of age. 90% of this improvement is due to two factors. The first is the reduction in infant mortality, and the second is the development of vaccines. I'm going to turn it over to Dr. Marcosi now for some more information. Marco?
Thanks, Dr. Santa. Good to speak to you all this afternoon, and happy holidays. Now that we've had some basic facts about the vaccines, we'd like to help you separate the facts from some bad information that may be out there. So let's talk through some of those myths with you that you may be hearing about the new COVID-19 vaccines. Myth 1, the Food and Drug Administration, or FDA, rushed through the COVID-19 vaccine trials. Dr. Sutta, I'm going to turn back to you because my microphone may be having some challenges.
Marco, I'm going to pick up for you because I'm thinking that we might have a bit of technical difficulty, and my hope is folks can hear me. So let's talk about myth versus fact. So myth is that the FDA rushed the COVID-19 vaccine trials, and therefore the vaccine probably isn't safe. The truth is that all of the vaccine products were still required to go through the same thorough process as they always do. All of the steps were the same, and the companies were still required to show that their vaccines were both safe and effective. To meet the shorter timeline for vaccine development, however, companies were allowed to conduct several steps at the same time when usually they occur one after another. The most promising vaccines were also able to start being produced before final approval so that vaccines could be distributed immediately if and only if they were approved by the FDA. To better understand the approval process, I'd like to talk a bit about the Pfizer vaccine clinical trial. A clinical trial is a process that vaccine companies go through to test their vaccines. And there are three main phases of clinical trials. Phase 1
You're muted.
is where
you can press
vaccines
star
are
6
tested
anytime
in
to
a
unmute
lab
yourself.
to figure out whether they are safe and effective. Phase 2, the FDA Advisory Committee, the same committee that recently recommended FDA to approve the Pfizer emergency use authorization, reviews a handful of finalists and compares them to each other. During phase 2, the committee is looking for the exact recipe and dosage that gives people the highest protection against an infection and the lowest number of side effects. For the Pfizer vaccine, the committee reviewed 5 different vaccine candidates at different doses, and it was based on that review that the FDA recommended a vaccine candidate to then move into phase 3 clinical trials. For the Pfizer vaccine, that meant 44,000 people took part in a phase 3 trial. 22,000 of them got the actual vaccine, and 22,000 got the placebo or no vaccine at all. What's critically important about these trials to understand is that everybody who participated in all phases of the study did so with full understanding of what phase of the study they were in and what the possibilities were and what information we had about potential side effects as they participated in the study. So by the time the phase 3 results were completed, the FDA Advisory Committee then met and reviewed all the information that had been collected. Then the committee votes on whether or not to recommend the vaccine as safe and effective for its use. So let me go to myth 2, which is that if you receive the vaccine and have side effects, it means that you've gotten the virus. So as clearly as we can state, it is biologically impossible to contract COVID-19 from vaccination. It's just impossible. This vaccine does not contain the virus. So you might experience side effects after getting the shot that makes you feel like you're getting sick. And actually, having side effects is a sign that your body's responding appropriately and the vaccine is working. That's because when you receive the vaccine, you're telling your immune system to start creating antibodies. And those are the antibodies that we talked about earlier. That's the body's response to jump into action. But I want to make sure that you also understand that if you don't have side effects after getting the shot, it doesn't mean the vaccine isn't working. Not everybody has side effects, so please don't worry. The vaccine is still going to be effective for people whether they have side effects or not from the actual injection. So the bottom line is that, yes, some people will experience side effects, but for the most part, these side effects are very minor and include things like fatigue and slight pain or soreness where you got the shot, just like when you get the flu shot. When the Pfizer vaccine was being tested, the most common severe side effect was low-grade fever and chills. But even those side effects went away very quickly. For most people, they were gone within 24 to 48 hours. In addition to side effects, I also want to address what you may have heard about allergic reactions to the vaccine. There is a remote chance that the COVID-19 vaccine could cause an allergic reaction, especially in patients who have had a severe allergic reaction in the past. So if you have had a severe allergic reaction to any ingredient in the COVID-19 vaccine, or you have a severe allergic reaction to previous dose, you should not get the Pfizer vaccine at this time. And if you've had a history of allergic reaction or something we call anaphylaxis that requires you to carry an EpiPen, you should talk to your doctor before you get this vaccine. This is going to be a requirement before the vaccination team administers your shot. Everyone who gets the vaccine will be monitored for at least 15 minutes immediately afterward, and people with a history of severe allergies will be monitored for 30 minutes. Additionally, every vaccine site will have supplies needed to address an allergic reaction if someone does have one. Marco, are you back online? I'm going to turn it back over to you. All right, Marco, I'm not sure if you're out there, so I'm going to just go ahead and keep rolling here. The next myth is that the vaccine, and hopefully I addressed this, contains live COVID virus. And so that there is absolute certainty, neither the Pfizer nor the Moderna vaccine, which you're going to start to hear more about in the coming days, has any part of the COVID virus. So just as we read the back of the cereal box for ingredients, I'd like to quickly list out the ingredients of the Pfizer vaccine. The Pfizer vaccine has just 4 main ingredients and only one active ingredient, which is messenger RNA. The messenger RNA is a chemical which naturally occurs in the body. The vaccine contains a man-made version of this chemical. The chemical causes our cells to create a protein, the spike protein of the coronavirus, which then your body reacts to. And this prepares your body to fight the real virus if it ever shows up, without having ever introduced the live virus into your body. The other ingredients in the vaccine are lipids, which is just another name for fat, so it's salts and sugars. There are 4 fats, which are basically tiny, greasy spheres that protect the messenger RNA chemical and help it slide into your cells. There are 4 salts, one of which is table salt, that keep the acidity level of the vaccine close to that of your body. And lastly, the vaccine contains plain old sugar, something called sucrose. So the Pfizer vaccine requires refrigeration, and the sugar prevents the frozen fat spheres from sticking together. So that's why it needs to be kept cold, and it's the ingredients that are in the vaccine. So here's another myth that we've heard from both our workforce as well as our community, that the Pfizer COVID-19 vaccine and other mRNA vaccines can change your DNA. So again, I want to be clear, messenger RNA vaccines like Pfizer and Moderna vaccines teach our cells to create these harmless spike proteins. In response, it's our own cells that start mounting the defense by making antibodies to protect us from future infection. However, messenger RNA vaccines never affect or interact with our body's DNA in any way. Actually, once your body's finished using the instructions from the vaccine, the cells actually break it down and eliminate the messenger RNA chemical from our bodies entirely. And that's important, so let me state it again. Once the messenger RNA has done its job, it's actually eliminated from our body. One more note about messenger RNA technology. Yes, it is new in the sense that it's the first time that we've actually brought it into clinical use. But it's something that researchers have been investigating and working on for more than a decade. In addition to its role in vaccines, messenger RNA is also being studied for its use to fight cancer. And so this is not new science. And that's a really important understanding when you wonder why it is that we could so quickly get a vaccine brought forward for use in this circumstance. In part, we're taking advantage of the science that has been going on for over a decade. So here's another myth. If you've had COVID-19 already, you're immune, and so there's no reason to get the vaccine. Truthfully, at this point, we still don't know how long you're immune to COVID-19 once you've been exposed to the actual infection. And so because of this, people with a confirmed prior COVID-19 infection can still and should get the vaccine. So here's another myth. Once you get the vaccine, you no longer need to wear a mask anymore or practice social distancing. The clinical trials for COVID-19 did not test how well the vaccines keep us from passing the virus to somebody else. Instead, what it tested was whether after getting the vaccine, your body could build up immunity and fight off the virus if you ever came in contact with it. Even once you get the vaccine, you could still come in contact with the virus and carry it on, and you could carry it in your nasal passages, which then could make others around you sick. Because of this, even after you've gotten both doses of the vaccine, it's still very important to keep wearing a mask and keep social distancing even after the pandemic is over. And this brings me to another important point about vaccines. Both the Pfizer and Moderna vaccines require you get 2 doses. This is very important. If you get the first shot, you must make sure that you get the second shot within the time frame that your healthcare provider tells you. Otherwise, you may not be fully protected and could still be at risk for contracting COVID-19. You may have heard this before, but I think it's a good comparison. You have to think about our fight against the virus like a piece of Swiss cheese. One layer of protection will certainly have some holes in it, as will the next layer and the next layer. But when you stack them together, you have a pretty solid block of cheese without holes that the virus can get through. That's how we should look at the tools we're using to fight the virus. The vaccine is one of the tools. It's a very important one, but just one. Wearing a mask and social distancing are other important tools that are in our toolkit that we have to continue to use. So soon we'll be hearing from two of our very own healthcare workers who got the vaccine earlier this week. But first, I'd like to share a video with you that shows the role our own School of Medicine had in the vaccine's development.
So it's been a remarkable year. The coronavirus, we have never seen it before. We have no immunity. It transmits well before people are symptomatic. Everyone working on this is worried about what this means for the general population, because as the virus spreads more and more, we will see more numbers and more cases. The sequence of the virus was identified in the middle of January. We were able to get one of the earlier samples from the first round of shipment from the CDC. That was really the key thing to get us jump-started. And it's been basically nonstop since then as we try to figure out what this virus does.
It's certainly going to take a multi-pronged approach. Social distancing, very aggressive and easy to access testing. We have vaccines, we have treatments. That's when we'll feel some degree of normalcy.
The speed at which the science is moving is really astronomical. The ability to be able to move a product this fast of a time frame is really unheard of before. Everyone is working together to get something out into people and the population as fast as we can.
I think about, how are we going to develop the vaccine, but also how are we getting it to the people who are at highest risk of both exposure and severe disease is not a trivial task. There is no choice. We have to develop a vaccine against this virus, or we're not going to control the pandemic, and we're not going to get back to our normal lives.
I've seen family and friends get sick from this. This is not for one person. This is for everybody. Everybody needs to be involved in this.
Vaccines are a very powerful tool that will immunize the population, and that interferes with transmission. It's an excellent way to control pandemics.
We have seen a lot of the health disparities in this country exposed. Minorities are certainly more likely to contract COVID. It's important that they be included as part of the research, as part of the clinical trials.
Thank you.
You're welcome. Thanks for participating.
A vaccine on a shelf never prevented disease. We need the trust and confidence of populations to be able to take these vaccines, and that's how we will prevent COVID-19.
Langley Park, as a lot of people know, in Maryland is one of the biggest hotspots for this virus itself. Everywhere in this community, people have lost jobs, people have lost family members, people are suffering from the effects of this virus that disproportionately affects people of color and the Latino community specifically. We partnered with University of Maryland for this study to bring such a world-class research team to the site where it's needed the most. This is a community that is willingly participating in this to make sure that a vaccine is developed that's safe and efficient for everybody.
And you are willing to continue in the study? Yes.
This is a stepping stone in really engaging the community. We believe it's also going to be very critical to ensure that everybody believes it's safe for them to use in being able to wipe this virus out.
That I'm the wealthiest person in the world because I'm doing good.
So we know how to beat this virus. We know that we can develop vaccines and drugs and antibodies to this virus. It just is going to take time. But in the meantime, there are all things that we can do. We can wear masks, we can social distance, we can wash our hands. The more people that do that in the community, the more that we can diminish the spread. All those little bits are really important for getting everybody through this pandemic.
We absolutely have to keep investing in basic science. That is the only way that we are going to have preparedness for the next pandemic or the next emerging infection.
They say we can do this together. Let's do this together.
So today we're joined by two medical system employees who are amongst the first to be vaccinated. Sean Hendricks, the very first medical system employee to receive the COVID-19 vaccine, and Dr. Thomas Merkel, the Chief of Medicine and Deputy Medical Officer at the University of Maryland Rehab and Orthopedic Institute. I'm sure you've heard a lot of talk of the vaccine in recent weeks, but we'd like to share with you firsthand what this vaccine really means to our frontline healthcare workers. So Sean and Dr. Merkel, thank you so much for joining us today. I know many of us, myself included, are looking forward to hearing about your experiences and the decisions that you made to be vaccinated. But first, I want to take a step back and ask you to share a little bit about yourselves and the work you do here at the medical system. So Sean, I'm going to start with you.
Thank you so much, Dr. Sonta, for having me today. I'm Sean Hendricks. I'm the Nursing Director of Medicine, Cardiac Services, and the Telecenter Program here at University of Maryland Medical Center. I've been at UMS now for more than 23 years, and as a part of my work, I oversee multiple COVID-19 care units, as well as the new modular care unit here at the hospital.
And thank you, Dr. Sonta and Dr. Marcosi, for inviting me to join this discussion today as well. I'm Dr. Thomas Merkel, and clinically I work as a hospitalist, but I also have administrative roles as the Chief of Medicine and Deputy Chief Medical Officer at UM Rehab and Ortho, which some of the community may still know as the former Kernan Hospital. I've been with the University of Maryland Medical System for about a decade now. I trained at the Medical Center downtown campus as well as the Baltimore VA Medical Center. And my day-to-day work is focused more on caring for rehab, post-op, and acute medical patients. While our facility, UM Rehab and Ortho, is providing care for patients with active COVID-19 infection, I have cared for many post-COVID patients who need rehab before they're able to go home.
So you both are really day in, day out working on the front lines of the COVID-19 challenge and making sure we're able to care for patients from the time they come into our system until the time we're able to send them home. I know we're all healthcare workers, but we're also members of our own communities, our own families, and this pandemic has affected each of us in very different ways. If I might ask, how has COVID affected each of you personally? So again, Sean, I'm going to start with you.
Personally, it affected me because my mother, brother, and brother-in-law all had COVID. My brother and brother-in-law were both fortunate enough to quarantine at home, but my mother was hospitalized for 2 months while she battled COVID. But I'm grateful and happy to say that they're all recovered, but it was definitely very scary.
You're being asked to unmute yourself. To unmute, press *6.
Can you hear me?
Yeah, Sean, we can hear you.
I'm sorry. And then also, it's been incredibly difficult to see the impact on COVID at work on a daily basis. It's relentless. I know you all in the community and across our system can relate. I know we are all tired, but I also know that we all know what it takes to get to the next to get vaccinated, to move to the next step forward to end this pandemic.
And personally, my nephew contracted COVID-19 while he was away at college. Thankfully, he's recovered and he's doing fine now. But I've also had several coworkers who have unfortunately contracted COVID-19. And I'll tell you, it's really difficult to see those you work with so closely go through something like this. That can be really unpredictable and quite serious.
Well, thank you, Dr. Merkel. And Sean, I really appreciate your perspectives, and welcome to 2020. I've had some technical difficulties, but I'm back online, Dr. Sonta, and I'd like to ask the next question to Dr. Merkel and Sean. Between work and your personal lives, COVID has had such a far-reaching impact. What made your decision to get vaccinated?
I think I must say I was definitely honored, and I was hopeful that I was able to, and wanted to be able to inspire my colleagues, family, friends, and the community to step forward when it was their turn to get vaccinated.
Yes, I agree with all the points that Sean made. COVID-19, as we've come to see, is so unpredictable and it's causing so much damage. And personally, I want to do everything that I can to protect my patients, my coworkers, and my family, and the rest of the community, especially those who do not yet have access to the vaccine.
Thanks very much for that. I guess I'll follow on with the next question, and Sean first, and then Dr. Merkel. How does it feel being two of the first employees to be vaccinated?
Again, I was thrilled. I always knew that I wanted to, once the vaccine became available, to be vaccinated. So there was never a hesitance there. And again, I wanted to make sure that I inspired many of my other, colleagues, as well as my community at large, to ensure that they were vaccinated. I always felt strongly about the vaccine and how critical it was to, have an impact in order for us to, again, to move forward in this pandemic. I'd, seen enough death within our hospitals, and I knew that if this pandemic was to move forward and not, worse and have our numbers increase, that we had to have widespread vaccinations.
Yeah, again, I'll echo Sean's sentiments. I was really excited and thrilled to be offered the opportunity to receive the vaccine so early on. And truly, I'm proud to lead by example and to help build trust amongst our truly dedicated workforce. I also know that my decision to get vaccinated also has the potential to influence the decisions of those around me to get vaccinated as well.
Thanks very much for that. Now I want to get to some of the specifics, the things we really want to know. Can you both walk us through the actual vaccination process and how you felt following that, Sean?
Personally, I didn't. I felt good, and I didn't have any side effects. I was monitored for 15 minutes after I got the shot, just to make sure that there were no adverse effects. And then the next day, I had some soreness in my arm, as I had before with any vaccinations, such as the flu vaccine. But otherwise, I didn't have any issues. I know some people may experience side effects, and that is that's a very personal thing, but it's not uncommon. I wouldn't let that discourage anyone from getting vaccinated, though.
Yeah, I would again say that the injection felt just like my annual flu shot. It was really quick and painless. And just like Sean, I was monitored by our staff afterwards for any immediate reaction. Really, aside from a bit of soreness at the injection site the next day, I felt great with no side effects. In fact, I'm back to ride my bike to work again today. So I will say, while I've been fortunate in that regard, I do know that most of the potential symptoms after vaccination are fleeting, and they really just signal that your immune system is responding as intended to the vaccine.
So we know that a lot of people are still hesitant or worried about getting the vaccine. What advice would you give to someone who's still trying to decide whether or not to get vaccinated? Sean, I'll start with you again.
I definitely understand the concern. I do, and it's valid. But I've dedicated my life to science and medicine. I've done my research, and I believe in the science behind the vaccine. But I especially urge members of our Black community to get vaccinated. We're 3 times more likely to be affected by COVID compared to any other ethnic group. We have to be smart about this. There are already over 300,000 deaths across the U.S. If we don't take a stand and protect ourselves through vaccination, more people, unfortunately, will either die or become sick. I feel like we now have a light at the end of the tunnel. So let's take this opportunity to get vaccinated.
Agreed. I also fully believe in the science and the safety behind the vaccine. And I do trust it's going to be a safe and effective way to protect myself and others from COVID.
So to Sean and to Dr. Merkel, thank you so much, as this has been so informative. thank you for sharing your thoughts with us today. And I want to make sure, do you have any final words for us?
I do. I think that we need to get this pandemic under control so we can all return to some type of normalcy. I know that we're, tired of not seeing our family members and not, able to get together, and for some, sending our kids to school. But this can't happen if people aren't getting vaccinated. I'll also say this: the holidays are coming up. We have to be sure we're still wearing our masks, social distancing, and unfortunately, I know that we don't want to hear this, but avoid gatherings. It's so important that we do this because regardless of our vaccination status, it's the best way possible to protect our friends, our families, and communities, and loved ones.
Agreed. The vaccine, it's a critical tool as we continue to fight and end this pandemic as soon as we can, but it's really just one piece of the puzzle. And as Sean mentioned, continuing to wear masks at work and in the community and around friends and loved ones, social distancing, avoiding large gatherings. You really can't emphasize enough how critical these things will continue to be for everyone, until we're all through this pandemic. And let me tell you, it cannot end soon enough.
Thank you, Sean and Dr. Merkel, for sharing your experiences. For those of you listening, I hope this has been helpful. As you know, while vaccine supplies are limited, we will be giving the vaccine out based on national guidelines that ensure an ethical allocation to various populations. This means starting out with our essential healthcare workers, followed by high-risk patients, and eventually members of the community. The truth is, we don't know how quickly we will move through these phases and when each person will be able to get the vaccine. But we promise to keep you informed as we get more information. And in the meantime, we promise to give you all the facts you need to help you make your decision when the time comes. I can tell you, Dr. Santa and I will both be getting the COVID-19 vaccine when it's our turn, and we sincerely hope you'll join us. Dr. Santa?
Yeah, that's right, Marco. When it is our turn, I will absolutely be getting the vaccine. And I come to that decision both from a perspective as a healthcare worker, but also as a father, a husband, and the son of elderly parents. But I've come to it with an understanding of the science behind the vaccine development and a faith that this decision is best for both me as a healthcare worker and also as a member of my community and my immediate family. But I also want to recognize that there are still some amongst us who might feel hesitant about this decision regarding vaccination. This is particularly true in our Black and brown communities throughout our region. And there's truth that part of this hesitancy is tied to the history of our nation and the history of violations, ethical violations, and injustices that have disproportionately impacted the health and healthcare disparities in some of our communities. And so it is particularly concerning to me that as I look at survey data that tells me that within our Black and brown communities, there are some of the highest levels of concern being raised about the decision regarding vaccination, that it tells me that our job as health systems have to be active participants in this conversation, to provide information so that all members of our community can make informed decisions. This is particularly important in segments of our community that are disproportionately impacted by COVID-19. COVID-19 has simply shined a light on what we've known as a nation regarding healthcare disparities. We have to acknowledge that reality and recognize that right now in front of us, we have opportunity to provide education and information that can help address risk in parts of our community that have higher risk. And so while we've seen promising steps toward health equity in the development of these particular vaccines, it's important to know that 10% of the participants on the Pfizer trial were members of our Black community. That over 20% of the participants on the Pfizer trial were members of our Hispanic and Latinx communities. And what we know from the data is that the effect of the vaccines was seen across all of the demographics that were studied. There was no difference based on race, based on gender, or based on comorbidities. These vaccines were effective in all of the communities and all of the participants that were seen and were studied. And so we need to continue to have these conversations and continue to build trust in the vaccine as we work with the communities that are disproportionately impacted by this disease. So before we close, I want to leave you with some additional thoughts about the upcoming holidays. 2020 has been an incredibly tough year for everyone. And I know in my house, we would love nothing more than to be able to celebrate this holiday season, to give thanks, and to spend time with family and friends and loved ones. However, we must also note that this is an unusual year. Yesterday, Governor Hogan again shared recently that family gatherings are the #1 source of COVID spread in Maryland. And I'm constantly reminded that the decisions that we make and that I make as an individual and as a healthcare leader may influence negatively the people that I love tomorrow. And so this year, I know that we are taking a break from our family's tradition of spending the holidays with extended family and friends. And that in my household, it will be only my wife and daughters that will celebrate our Christmas tradition this year. And this will be dramatically different. And the truth is, it will be hard for us. But our view is, my hope is, reflects your view, which is what we do this year will impact who we get to celebrate holidays with in the coming years. So as one of the trial participants, Mr. Townsend, said so eloquently in the video, let's do this together. Thank you.
Thank you, Dr. Santa and Marcosi, for leading our conversation today and sharing more information with us about the COVID-19 vaccine. And a big thank you to everyone who joined us today. We hope that you will stay connected. You can find our social media channels displayed on the screen, and hope that you will sign up for health and wellness emails at umms.org/email. You can also find more information about the UMMS COVID-19 response at umms.org/COVID. Finally, please remember that you can call our free nurse call line anytime, day or night, to discuss your concerns or possible symptoms. You can reach our nurse call line at 1-888-713-0711. We are grateful for everything you are doing to keep yourself, your loved ones, and your community safe. Happy holidays, and have a great afternoon.